Greetings, live. We're live, I believe we are live. And I have got a list of questions here, which I'm going to go through. And these are questions that I've been asked throughout the week. And I'm going to go through them one by one. If you have any questions and you want me to answer them here and now, then please feel free to comment live and I will answer them if I see them. And if I don't, I will answer them when I see them later. So we got a few questions around the polyurethane implant topic, rate of capsular contracture versus silicone implants. Do many patients opt for them? Potential to see the edge, and is the size the same as silicone? Okay, so the rate of capsular contracture for polyurethane implants is a lot less than silicone implants. That is the reason, the main reason for having them. Look at the camera. Where's the camera? There it is. The main reason for having them. So the rate of capsular contracture with silicone implants, with the best figures we've got, is 15 to 20% at 10 years. So if someone tells you a rate of capsular contracture, then because sometimes people say, oh, these implants have got a rate of capsular contracture of 5% or 1% or less than 1%. If they give you a rate for capsular contracture, there has to be a time limit associated with it. So obviously, well, maybe not obviously, capsular contracture is the progressive tightening of the scar tissue around the implant. The scar tissue around the implant is known as a capsule. Every single person with implants has got a capsule. So a capsule is normal. And then as that capsule contracts, then that causes the problem. It makes it go hard. So in the first year or so, no one has a capsular contracture. It's very rare to have a capsular contracture in the early stages. It progressively comes over time. So if someone says there's a capsular contracture rate of less than 1%, well, they might be talking about in the first 6 months or year after surgery, in which case every implant has got a capsular contracture rate of less than 1%. So yeah, you have to have a time scale associated with it. So silicone implants, you're looking at 15 to 20% capsular contracture rate at 10 years, which means at 10 years, 1 in 5 women will have a hard implant, 4 in 5 will be fine, and then it goes up 1 to 2% per year. Capsular contracture with polyurethane foam implants is 1% at 15 years. 1 in 100 at 15 years, much lower rate of capsular contracture, which is the good thing about it. One of the bad things about it, the question here is about, they're a bit controversial, and we go through this in the clinic, and I'll send you details about them, because none of the big companies like Transform, Harley Medical, Hospital Group, and all the big companies, none of them use them. They only use silicone implants. In my view, I think it's good to tell people about them, even if you don't use them. So I think it's good to be informed about them. But some surgeons don't routinely use them for first-time breast augmentations, will only use them for people who've had recurrent capsular contracture. That's how I used to use them. I used to only use them in people who had recurrent capsular contracture. I do use them now in primary cases, and I offer them to everybody, but I don't push it. Sorry about that. Don't know if you got that. That was the dog making an entry. I do offer them to everybody, and I use them in about 75% of my cases, 25% silicone, 75% polyurethane. So how many patients offer them in my practice, but nationally probably more silicone implants are used than polyurethane, because, as I say, not all surgeons will offer them. They are a little bit more difficult to use. There's a bit of a learning curve with using them. I've been using them for many years now, and as I say, I mainly use them, but I think they're good, but I give everyone the option. I still offer silicone implants, and you can still get great results with silicone implants. As often the case, there's no right or wrong. It's just what you feel is best in your case. Possibility of seeing the edge. It's hard. You don't often get to see the edge of the implant, but you can often feel the edge of the implant with polyurethane foam, which is not, you don't often get with silicone implants. And I do tell people in the first year they are a bit of they can feel them, and they feel a bit firm, and there can be a little bit more trouble than silicone implants, and then over time they soften. They're okay after that. But yeah, that's a bit of a This ding dangler's not good, is it? Sort that out. I have got another microphone which I could use, but left it in the office. So you can sometimes feel the edge, yeah, but it takes about a year for that to settle. Many patients also the same size as silicone. Yes, they do come in the same sizes as silicone implants. Well, broadly similar. So I normally talk to people in the clinic about one or the other, about silicone or polyurethane, but I say that if you want the other one, they're about the same, thereabouts. Within a few millimetres, they'll be about the same dimensions, and we can always find one comparable. So there's no difference in sizes, shapes, profiles. They come in low, medium, high, extra high, teardrop, round. In fact, they come in more. They come in teardrop with a round base, teardrop with an oblong base in the horizontal direction and oblong in the vertical direction, so they come in actually more shapes and sizes, but anyway, broadly speaking, yeah, they're about the same size and shape. So there we go, polyurethane question absolutely covered comprehensively. I think you will agree with me. Have the celebrity had the work done? So this is a media request, sometimes get asked about whether people have had something done, looking at before and after photo. These are always difficult questions because certainly when you're talking about breast, they're usually clothed, and it's always difficult to say when people are clothed because underwear and the clothing you wear can change the shape of your breasts. This particular one was a face, and the big thing about the face is the makeup. You get a picture before and after with makeup, and the people can look transformed. I don't think it's on anymore, that 10 years younger program. Is it still on? I don't think it's still on, but whenever that was on, I used to watch that, and I always thought the huge transformations comes in the hair and the makeup. The teeth was often a massive transformation, and people can often have quite extensive surgery, but the results are not often sort of wow, and what is often the case is that a good surgery is often not very obvious, and many people don't want, particularly with a face, they want to look refreshed, they want to look natural, they want to look younger, they want to look less tired. They don't necessarily want to look like what people got this vision of someone who's had facial surgery or Botox or fillers, injectable treatment. There's an image of what that looks like, but not many people actually want that. And so if it's done well, it often looks quite subtle and look like you haven't had anything done. And so I don't, when I get asked these questions, it's often, I can't say categorically whether someone's had something done, because usually in the before and after photo, in the after photo they've got makeup on, in the after photo they're smiling, they've got blusher on. So have they had cheek fillers, or is it just that they're smiling that they've got blusher? Have they had skin resurfacing? Have they had dermabrasion or chemical peel, or some kind of acid peel or laser skin resurfacing, or have they just got makeup on? It's hard for me to say, and so it's just people looking a bit refreshed and a bit younger. So that was the one for the celebrities out there, of which I'm no doubt that there's many watching this broadcast. No doubt in my mind about that. So big shout out to the celebrities. Give me a thumbs up, celebrities. Yeah, as I thought. Good. Yeah, okay. And then uplift or implants, or both. Massive one. Get this a lot. This particular case, so people often say to me, I want implants. Can I have implants, please? Because I'm happy with my breasts. I've lost volume. I've breastfed. I've lost weight, maybe. And you say, fine. What's your cup size? And they say, I'm a whatever, whatever the back size is, D or E cup. And I say, what size would you like to be? They say, well, I'm happy with the D or E cup or C or whatever the size is. It's just the shape. They're droopy, and I want to have them, implants to have them look better. And certainly in this case, I think the shape is a lift. Implants is the size. So if you're happy being a D or an E cup and you don't want to be bigger, I would say forget implants. Just have a lift. If you've got enough volume there, get that volume back in the right place, bring it up onto your breast. Just have a lift. Don't have implants. The lift is the best way to change the shape of the breast. If it's the shape that you don't like, just have a lift. obviously, this is difficult because we have to talk in the clinic because lift's got scarring and potential for complications and things, so we have to talk about that, but it's the best way to change the shape of the breast. If you're going to use an implant, you can use an implant to change the shape of the breast, but two things. First of all, it has to be a certain width of implant. It has to be a certain size of implant in order to take up the slack skin. You have to take up the slack skin somehow, so you either do that by cutting it out or you do it by adding volume with an implant. So it has to be quite a big implant in order to take up that slack skin. So you have to be quite a bit bigger in order to do that. And the second thing, the really important thing, is some people need a lift whatever. And if your breasts are sitting really low, you just can't make it right with just implants. Because if you put implants in, you have implants here, your breasts are sitting low, your implants are sitting there, it just makes your breast bigger, the same shape but bigger, or even worse, it could be got elongated shape because your breasts are sitting low. So some patients just have to have a lift, whatever. And you can combine the lift with implants if you want to be bigger as well. But often it's just the shape that people don't like. And if it's just the shape you don't like, just have a lift. Don't have implants. If you want to be bigger, by all means have implants. Now the rider on that is that we'll go through pictures of people who've just had lifts, because there is a certain shape that you get with a lift. When you first have a lift, it's up here and then it settles, and some people want that fullness in the upper pole to stay, and the only real way you can get that fullness in the upper pole to stay is with implants. A lift brings your natural tissue up there, and your natural tissue is operated on by gravity. The bigger your breast, the more it's operated on by gravity, so it will settle and you will get a slope in your upper pole, which is a natural look, but some people don't like that. Now that is when, and I'll show you photos of that in the clinic, and that is people out of a bra. Remember, in a bra you can always push them up and do things, but out of a bra you do get a more natural shape to your breast with a lift. If you want sustained fullness in the upper part of the breast, then that is when implants do come in, and so implants can do that. But personally, I wouldn't particularly advise you have implants just for that bit of stable fullness in your upper pole of your breast, because they'd have to be a certain size of implants to give the width of the breast. Because obviously if they're round implants, the width or the base of the implants round, whether they're round or teardrop in shape, if the base is round, the width is the same as the height, and you need a certain height in order to give that fullness up there. There's no point in putting a small implant in, because if it's not high enough, it doesn't give you the fullness, which is the reason you're using the implant in the first place. So it'll have to make the breast a certain size bigger, and so I wouldn't advise having it a certain size bigger unless you wanted it bigger. So if you're a 30 whatever 2 or 4 or whatever the number is, E cup or D cup, and you're happy being that, but you don't like the shape, just have a lift. Don't have implants. And the other thing about lifts and implants is it's quite a big op, a lot of complications. A lot of people don't do it in one op, they stage it. And so in circumstances like this, I'd say, look, just think of it like a staged procedure. Just have whatever you, so have, say, the lift to start off with. If you're unhappy, you could always have the implants at a later date. It does work out more expensive that way, but it might be that you're happy with the shape and you don't want them to be bigger, and you're happy with that, and you don't need the implants. So it might be a cost saving, it might not, but also it's less complications doing it that way. And some surgeons will routinely do it that way. They'll do a lift first. Well, it doesn't matter which one they do. They can vary which one they do first. They do one first and then do the other. So in circumstances where you're a certain cup size and you're happy with that cup size, just have a lift. Don't have implants. Take home message. So that's good. Buonasera. We got a comment. Buonasera. Back to you, Anna. Awesomeness. So that's it. That's my questions for the week, and good lot of questions this week. I think you'll agree. Happy with that haul of questions. As ever, ask away. Don't be shy. Facebook me, Twitter me, email Laura. Whatever your preferred method of contact is, by all means, please get in touch. Zopim on the, you don't know it's called Zopim, the online chat on the website. So if you want to get in touch, please do, and it'd be great to get involved with that breast uplift with implants. I've just done a blog post about that as well. So plug for the blog post. Was it a blog post or a video? Doing more YouTube videos these days. I'm looking at one a week is my goal. I'm going to become a YouTuber by the end of the year. I'm going to get crazy and have a ridiculous amount of subscribers. We've got 40 at the moment. We need 100 to get a nice name on YouTube. You can only get a nice name on YouTube if you've got 100 subscribers. I think that's right. So if you're out there and if you're not a subscriber on the YouTube channel, I should have put a link, shouldn't I? You can find it. I hope it's easy to find. Styano Clinic or Styano Plastic Surgery. Please subscribe. And that's me checking myself out. How do you get those to have a subscribe box come up here? That'd be good. I'm not sure if you can do it on Facebook Live. Anyway, checking myself out of here, and as ever, it's been a pleasure. And I will see you this time. Actually, next week I might be a bit late, so watch this space. I'll let you know. Might be a bit late next week because I've got a late list. But anyway, for this week, I'm going to check myself out of here, and I'm going to let you get on with your evening. And thanks for staying. Thanks for coming, and have a great evening. Buona sera to you all.